Hello, everyone. We are here doing another career pathways. We have a special guest here today. I will have him introduce himself.
Mhm. Hi, my name is Tony, and I'm a phlebotomist. I work in a local hospital here in Milwaukee.
Okay. And so, Tony, can you explain what you do as a phlebotomist?
Well, as a phlebotomist, I am the one who poke the patient in order to get their blood
Mm-hmm.
for the test that their doctors are asking for and bring it to the lab.
Is this something that you had interest in before, or what led you to become a phlebotomist?
Well, when I was living in Mexico, I worked in a pharmacy for 11 years.
Mhm.
And when I came here, I was like, what should I do? So I started learning some English first, and I was still interested in getting to the healthcare field.
Mm-hmm.
So one of my classmates told me about this phlebotomy career that I
Mhm.
didn't know about, and I did my research about the career, and I got like, oh, this is something that probably I would like to do. So I, and that's how I ended up being a phlebotomist.
Okay. Um, so let's see. You were recommended by a friend to go into the phlebotomy program. What did that program consist of?
Well, this program is you apply online. You
Mm-hmm.
go to the website of this uh, in this website and apply online. You only have like 3 days, I think, to apply, and it's a lot of people who apply for this program
Mm-hmm.
because it's free.
Mm-hmm.
Uh, and they only accept about 10 people,
Okay.
so it's really hard
Yeah.
to get into this program, but it's really good. I mean, it's short. hmm
So when you're saying that it's short, how long is the program for?
uh, it took me like 2 weeks of only like the basic stuff, like the theory stuff,
Mm-hmm.
and after that they place us on the work setting,
Okay.
and we start like shadowing the other phlebotomists around the hospital, and getting more like hands-on the job.
Mm-hmm.
So it's like we still get trained in the hospital like for about 4 to 6 weeks,
Okay.
depending on, yeah.
So, you were one of 10 people to get chosen for this program.
Yeah, I was one of the 10 between, they said like at that time was like almost 1,000 people
Oh
who
my
applied.
gosh.
Yeah.
So, what do you feel set yourself apart from other people? Obviously, you must have impressed them.
Yeah, and when I applied, I was kind of afraid because at that time I was still taking some English classes because
Mm-hmm.
English is not my first language.
Mm-hmm.
So I was like, probably they're not gonna accept me because my lack of English.
Yeah.
But I got impressed that when I got interviewed by them, they said that I was a good candidate because uh, my I speak Spanish too, and they
Mm-hmm.
say they have a lot of Spanish speaker patients.
Yeah.
And because I was working in the food service area or field, so I worked in a restaurant for 3 years and a half.
Mm-hmm.
So that also helped me to get into the program because I know how to work with people.
Yeah.
Yeah.
So it's like really important to be able to communicate, I'm sure, with the patients that come in.
Yeah, yeah, and I feel like that also helped me to improve my English too, because
Mm.
yeah, I have to interact with nurses, doctors, and patients. So
Yeah.
yes.
So, I want to kind of go back a little bit, and then come back to the phlebotomy. So, what did you? So you said that you needed to go through this particular program. What does it usually consist of? Like, um, so you went through one streamline of getting into the program, but it's usually a different way as well, like schooling, like the more
Yeah.
traditional way.
Yeah, when I was taking my English classes at METC, they also offer this program there, and it's short. I mean, it's a year or something like that, like
Yeah.
about a year. And I think it's a good way to take, because they can teach you more about the phlebotomy. Um, Here, the program that I took, it was more like straight to the job.
Yeah, like an accelerated.
Yeah,
Yeah.
So, but I feel like going to the school, like for example, MATC, to take this program, yeah, you get more knowledge.
Yeah.
Yeah.
Okay. And so how long have you been working as a phlebotomist?
So far, it has been like over 2 years.
Wow.
I started in January 2020.
Okay.
Yeah.
And when you started, what were there opportunities for growth?
Yeah, there is always like opportunity to grow.
Mm-hmm.
I started as a flex one,
Okay.
And I was just working, and then a few months after I started working and doing my job, they offered me to train the new flex. So I start training the new flex
Wow.
on the hospital, in the hospital, and now I'm a flex two. So I kind of got promoted to flex two just like a few months ago.
Oh, okay. Well, congratulations.
Thank
That's
you.
great.
Thank you.
You must be really doing some great work. What do you think led to like your promotion? Like, was there something that they saw in you that?
Probably because I'm always like willing to help in other departments. Like if they need help in the ER, I work in the ER for some period of time. Or if they were short on staff, I usually go to help them. And I work with sometimes with outpatients. So yeah, I've been like always like willing to help, and I like work. So
Yeah, and so like doing things that weren't necessarily asked of you then.
Yeah.
That's great.
Yeah.
Can you tell me about some barriers that you may have faced in getting to where you are now?
Well, barriers. I think sometimes I feel like still my communication skills, like my speaking, and most. I think that's the most thing that I feel like that's a barrier for me. But I'm kind of getting it a little better now, and because now in the setting that I'm working now is a clinic for outpatients. Yeah, so I have to do a lot of phone calls, calling doctors and nurses, and so that's making me to talk to improve more.
Yeah.
So.
But I guess like what could be considered a barrier could be so helpful for those who are looking to have someone care for them that could communicate with them.
Mm-hmm.
How has that experience been for you?
Like,
So I guess like I'm asking like there's also like patients who face the same barrier,
oh,
and like to be able to communicate with one another in a healthcare situation that could be, you know, kind of scary or difficult.
Yeah.
Like how has that been to be able to kind of comfort them in their own language?
Yeah, it has been like a little like challenging at the beginning, but now like it's a little bit more like more comfortable. Yeah.
Okay.
Yeah, I feel more
Okay.
comfortable.
So can you just explain or review a day in the life of your career?
Life of my career. Okay.
Mhm.
Well, I start by restocking my tray.
Mhm.
Um, and now in the clinic setting, so we rotate every day. I also learn how to register the patients, and I learn how to process the specimens. So we start my day by looking on the patient list and just like calling them to the little spot that we have
Mhm.
to draw their blood, uh, look on their orders if everything is correct, if something is wrong or kind of a little out of place, so we have to make sure the doctor is calling for the right test.
Mhm.
Um, and we always help each other with my coworkers. We have a really nice team there, so we always help each other.
So in this team, how many people do you work with usually?
We are seven.
Okay.
Seven people.
And there's
Yeah.
other phlebotomists as well.
Phlebotomists, yeah, we are all phlebotomists and we are all rotate.
Mhm.
Yeah, doing the different stuff like registering and processing and all that. So that makes the week going like fast,
Yeah.
and you are not doing like just one thing. You are doing different stuff.
What has been like your favorite area to work in?
I like the poking stuff.
You do.
Yeah, yeah, and I like it because I always try to be as gentle as I can with the patients.
Yeah.
And I like when they say, "Oh, I barely feel that." I'm like, "Okay, that's my goal. So you don't feel anything." So I always try to be gentle with them. And now learning the processing area, I like it too. Yeah, yes, I'm learning like a lot of stuff that I didn't know about the blood and all that. Yeah, so it's pretty interesting.
That's great. I feel like I would be a nervous wreck trying to draw blood. Were you nervous going into this?
Yes, yeah. At the beginning, I was like so nervous and afraid to harm the patient because I was like, it can look so simple, but you have to be careful because we have like a lot of nerves and tendons that we don't want to hit with the needle. So I learned how to feel the veins with my fingers. So sometimes you have patients and you don't see any veins.
Yeah.
But you have like learn to feel them, and I'm like looking away. And, oh, okay, the vein is right here. So you develop skills that you don't even know you have.
Yeah. Oh my gosh.
Yeah.
And what about patients who are nervous? How do you comfort them? How do you get them to trust you? Because people have phobias when it comes to this.
Yeah. And even they say like, oh, I'm a big baby. Sometimes they're like, I'm a big baby. Okay. I want you just to relax,
Mhm.
and I always try to talk to them to keep
Mhm.
them like relaxed. Hey, tell me how's your day going, and blah blah blah. And when I'm about to poke, I just like deep breathe and
Mhm.
boom and poke, and they like, oh, that helps. That
Yeah.
breathing, yeah, yeah, just breathe, and the hard part is like 2 seconds.
Yeah.
Just while the needle going.
Yep.
Once the needle is in, you don't have nothing to worry about.
So I guess when it uh, comes to like the characteristics, like the personality of a good phlebotomist, who would be considered a good phlebotomist? Like who would be like the best person for the job? It sounds like definitely communication. Like
Communication.
yeah, any other
Yeah.
characteristics that you can think of?
Communication. And obviously, like your how can I say, like aspect, or like don't show like nervous,
Yeah.
or like being sure that you know what are you doing.
Yeah, you want to show confidence.
Confidence, exactly, like show confidence. And what else? Just make them feel that you are knowledgeable, that what are you doing. And yeah, I mean,
Yeah. Have you ever had any difficult individuals, and if so, how have you dealt with that?
yeah. So in the when I was working with the inpatients, so it's different, because patients, when they are in the hospital, they get poked like a lot, because the doctors need to check their blood levels like every certain period of hours, and they get like tired of being poked, but I always try to like tell them like, okay, this is for your good. So, and even they're mad, or they're like, peace or something like that.
Yeah.
So I'm like, okay, this is for your good. I know it's hard for you to get involved, but and I always let them know you are in your right to refuse. I mean, if you don't want me to try your blood,
yeah,
you are on your right to refuse, but I need to tell your nurse, your doctor.
Yeah.
And sometimes I convince them.
Yeah.
But I kinda always like slow my voice, try to get them calm, and just like trying to convince them.
Yeah.
Sometimes it works, and it depends on how to approach to them.
Yeah.
Yeah, like if you approach in a good manner, like they kinda understand, and they let you do your job. And
Sure.
yeah.
Yeah. So it sounds like you, those who may have like we said before, good communication skills, like a nice, comforting demeanor to to make them, the patient, comfortable too. Like those are really good like personality traits.
Yeah, but there is like some hard situations, in, like for example ER, or
Yeah.
where the patient is just like so agitated, or they just don't want anything or anyone to be in the room, so you can do much. So
Yeah.
just give them some space, and hey, I'll be back in maybe an hour.
Yeah.
If that okay, and they agree. So
Okay.
yeah, so we have to learn how to manage the situation, and always like try to keep our like neutral level.
Sure. Is that something that, like, in your training that you learned, or is that something that you think is just something that you developed on your own?
I think that's something that you develop in your own and in your daily working days. Yeah, so
Okay.
yeah, it's something that you develop.
Yeah. I wanted to go back to, like, your school and your training. Like, it sounded like it was uh, sort of like a program that went fast. Like, how was that program? Like, was it a lot of studying that you had to do beforehand? And
Yeah, we had a binder with all the stuff, the uh, theory
yeah.
that we need to know.
Mm-hmm.
We study a little bit of the how is it called, anatomy, like
Yeah, anatomy.
the anatomy,
Mm-hmm.
yeah,
Mm-hmm.
the arm, and to identify the veins
Mm-hmm.
and names of those principal veins, the main veins that we have, arteries that we can touch,
Mm-hmm.
and the order of draw, because we have to follow an order
Oh.
to draw those tubes. You know, like those tubes they have like different colors, so there is a order to draw
Oh.
those tubes. So
I
it's
never
not
knew
like,
that.
yeah, so it's not like, oh, let me just draw the red and use the green. No, there is a order for those tubes to draw.
So, like, with the order of the tubes that you're drawing, like, is there like a specific amount that you're supposed to draw in each tube, or?
No, it's mostly the chemicals that are inside of those tubes.
Okay.
Yeah, so if you draw the tube in the wrong order, you can affect the result of those tubes.
See.
So and that can lead in a inaccurate result.
Oh, okay. I never knew that. That's
Yeah.
interesting to know.
Yeah.
What do you do if like, let's say you can't get, blood out? Because sometimes I've been, like, where a person will draw and it's just not working.
That happens, yeah.
Okay.
Yeah, but we have the option to poke twice the patient, and we try twice. And if we don't get any blood in those two tries, we have to call someone else to take a look and see if they can feel or see anything on the patient. Yeah, but we can, like, multiple pokes, no, just two pokes.
Okay. Are there, like, certain patients that it may be more difficult than others? Like, I don't want to, like, assume, but I'm guessing, like, children may be kind of more difficult versus, like, an older adult, or?
Yeah, like now in the clinic that I'm working now, I learned how to draw kids. So for it's like everything. There are like some really brave kids.
Yeah.
They like, okay, here's my hand, and they don't even cry or nothing. And some others that it's kind of hard, so you need help to hold their arms.
Yeah.
And something like that. And for patients, especially when they are like receiving like some kind of chemo or they're like really dehydrated or they are in a certain diet.
Yeah.
So that makes their veins a little bit more like difficult to find. Yeah. So or patients with really deep veins, so that you can kind of feel it. But you learn.
Yeah.
Yeah.
I guess, like, one of my last questions is like, what um, what advice do you have for a young person that may be interested in getting into phlebotomy?
Well, go for it and try it. Just it's a really interesting career,
Mm-hmm.
and for me, it was like I want to help others, so I like to work with people. If you like to work with people, go for this career. Is a really good career, and you have different areas that you can work on. Like it can be in a hospital, in a clinic, or in those like labs,
Mm-hmm.
like I don't know, like is there like a particular labs or
Yeah.
something like that?
Yeah.
Yeah, for plasma or something like that.
Mm-hmm.
Yeah, so there are like different paths, and even in the hospital there are like different areas that you can work on. So it's a really I love my job. I love
Yeah.
my career, so I'm so happy that I choose this
Mm-hmm.
phlebotomy
Mm-hmm.
career. So yeah.
And another question that I have as well is you talk about like forming a career out of this. Is Do you feel like this could lead you into another area of the medical field? Have you thought of that, or do you think like maybe just sticking with phlebotomy for now?
For now, I think I'm sticking with phlebotomy, but
Okay.
also I would like to become like a tech.
Okay.
So the techs they also place IVs. They work mostly in the
Oh.
ER.
Yeah.
Yeah, and that's another area that is really attractive to me.
Is that like a different skills needed for like a tech? Would you have to gain more education on how to place IVs in versus
Yeah.
like a blood draw?
I think you need to get a little bit more education
Mm-hmm.
for that one. But skills almost the
Okay.
same ones as a phlebotomist.
And so in like a career path, you could start as a phlebotomist. Like there's an area where you can become a tech. Have you seen how people have navigated like a career? Like, is there anything kind of beyond that that they can go into, or like a supervisor type role, or?
Kind of, yeah,
Mhm.
or a lead.
Okay.
You can be a lead, phlebotomy lead, or yeah, there's like
Sure. And so, what would a phlebotomy lead, or is it just like supervising other
and
like your team?
supervising, yeah,
Mhm.
just making sure everyone is working as it should be, and just be there for whatever question they have or help them.
Mhm.
Yeah, any questions or something like that. Yeah.
And my final question, I think it's you've had such an interesting journey of again like just English not being your dominant language. Do you have any advice for individuals that they may be learning like English, or they're bilingual, like any advice in regards to like their educational journeys?
Yeah, so well, just don't give up.
Mhm.
I know English is not an easy language to learn, but you have to be consistent and pushing yourself,
Mhm.
and just go for that goal that you have, and you'll get there. So I'm here, so I came here without speaking any word in English, so now I feel more.
Yeah.
Yeah, so you can do it.
Yeah, now you have a successful career.
Yeah.
So thank you so much, Tony, for your
Thank you.
time. We
Thank you
really
for having me.
appreciate it. It was really interesting learning more about what you do and the different areas in which you can go into. It seems like the possibilities are endless. And this is something that, again, I think that young people can go straight maybe from high school into a career path.
Yeah, and this is I think a good opportunity to step into the healthcare
Mm-hmm.
field because it's so big. You have like so many options.
Mm-hmm.
I never thought how many options do you
Mm-hmm.
have once you start working in the healthcare field. Just like, oh my gosh, there's this, is there, and that, like
Mm-hmm.
so many
Well, thank you so
options.
much.
Oh no, yeah, you're welcome. Thank you for having me.
No problem.
Bye.
Bye.